Welcome to CRAC Medicine channel. On this video, I'm going to take you through how to take history taking. Simple and easy. But before I do that, please kindly click on the subscribe button below and turn on the notification bell so that you don't miss on the next coming video. First of all, you have to identify your patients, go introduce yourself and gain the consent to speak with them. For example, there is the patient. You come say, "Hi, my name is Dr. Fiona. I'm going to be your doctor for today. Is that okay with you?" Finish. Or in case you are a medical student, you can say, "Hi, my name is Fiona. I'm finally a medical student. Today I've been asked to come and take your history. Is that okay with you?" Simple. Finish. Done. Then move on number 2. Ask the patient for their details. The name, the age, the gender, the religion, and the address. Move on to number 3, which is the presenting complaint, also known as the chief complaint. This is what the patient tells you is wrong with them. For example, the patient may tell you that they feel dizzy, or they have a headache, or they have a chest pain. This is the chief complaint. What brings the patient to the clinic or to the hospital today? Under the chief complaint, or after you have done collecting the chief complaint, you can now explore the complaint. There is a mnemonic which is usually used, known as the CRAC. Here you're going to ask the patient about these things. There is site, the onset, the character, the radiation, association, time course, exacerbating, and severity. So first of all, you ask them where exactly is the pain and when did it start. That's the onset. Is the pain constant or intermediate? Is the pain gradual or sudden? Then ask them about the character. What is the pain like? Is the pain sharp, burning, or tight? Then number 4, you have to ask them about the radiation. Does the pain radiate or move anywhere, or is the pain localized? Then number 5, ask if there is anything else associated with the pain, for example, sweating, vomiting, or shortness of breath. Ask them about the time course. Does it follow any time pattern, and how long did it last? Does anything make it better or worse? And then lastly, ask them how severe is the pain. That's the severity. Consider using the scale of 1 to 10. Ask the patient to scale their pain to you. Once you're done exploring your chief complaint, now you can move to number 4, which is to gather information about a patient's other medical problem, known as the past medical history. Ask your patient if there is any medical problem or they are living with, like maybe our patient is asthmatic or maybe our patient is hypertensive. You have to ask them if there is any other medical history they have in the past. Then move on to drug history. Here you have to find out what medication the patient is taking, including the dosage and how often they are taking them, once daily or twice daily. Then ask the patient about the allergies. Do they have any known allergies? And also don't forget to ask them about if they have any surgical history. Then move on and ask the patient about the family history. Here you have to gather some information about the patient family history. For example, diabetes or cardiac history from the family. Find out if there is any genetic conditions within the family. There is an example of a genetic condition. And then move on to ask them about the social history. This is the opportunity to find out a bit more about the patient background. Remember to ask about smoking and alcohol. And if the patient do smoke or drink alcohol, you have. Number 8, review of system or system review. Here you have to gather a short amount of information regarding the other system and the body that are not covered in your history of presenting complaint. You have to review your patient from head to toe, and maybe you have missed something on your history. This is the right time to pick some important information that you might have missed when exploring the patient's chief complaint. Once you are done with system review, now you can move on to number 9, which you have to summarize your data. Here, when you are satisfied that you have completed the history taking, tell the patient that you have covered everything that you need to, and check that the patient has nothing more to add. Summarize the information and check that it is complete and accurate. Explain what will happen next to the patient. Number 10, very, very important, you have to thank your patient after you have done collecting your history from them. I hope you really enjoyed this video, and if you did, please like and leave a comment below. Don't forget to subscribe.